Well, hello, everybody. This is Allie Orwig with the Indiana Rural Health Association. We appreciate you joining us today. We're going to go ahead and get our session started. Great presentation for you today. I just want to remind you a couple quick housekeeping items. The first is that we are recording today's presentation, so you will be able to view that by the end of the week on our YouTube channel. The second is that if you have any questions during the presentation, please use the chat or Q&A function. And Carolyn Miller and myself will try to keep an eye on those and act as moderator for our presenter. And then if you have questions at the end of today's session, you are welcome to use the raise hand function and we can unmute your line if you would like to verbally ask a question. All of those functions can be found by hovering either at the top or bottom of the screen, depending on which view mode you're in. You'll either have a drop down or a pop up with those buttons for you. But I believe that is all I have as far as kickoff items. So without further ado, I will go ahead and turn it over to you, Margo.
Thank you, Allie. I am Margo Knefelkamp. I am the program manager for Indiana Emergency Medical Services for Children and have been for 5 years now. The IEMSC program director is Dr. Elizabeth Weinstein. She is a duly trained emergency medicine physician in both adult and pediatrics with a robust advisory board. Indiana's EMSC program is funneled through the IU School of Emergency Medicine and just started year 13 of the grant. Since Indiana's program is academic based, we have an agreement with the state EMS division at the Indiana Department of Homeland Security, and Indianapolis EMS offers in-kind support for this statewide program. I'm here today to share the National Pediatric Readiness Project, or the NPRP, that is currently underway. This is a especially important project for those who work in general emergency departments that are not dedicated pediatric emergency departments. 83% of pediatric ED visits occur in general emergency departments. And while a lot of these kids have the sniffles or maybe a little bit of vomiting or diarrhea, occasionally you will see a very sick kid or an injured kid. So it's important to be ready. The National Pediatric Readiness Project, or the NPRP, is a multi-phase quality improvement initiative to ensure that all U.S. emergency departments have the essential guidelines and resources in place to provide effective emergency care to children. This initiative is a collaboration with the American Academy of Pediatrics, the American College of Emergency Physicians, the Emergency Nurses Association, and the 58 National Emergency Medical Services for Children programs. In the words of Dr. Weinstein, since our Wicked Big Assessment survey in 2013, we have been using benchmark data to develop programming and resources to improve pediatric readiness in EDs across the state. You may be familiar with Indiana's Pediatric Readiness Facility Recognition Program that launched in 2018. Much like trauma centers and stroke centers, Indiana now has pediatric ready facilities. Indiana emergency departments may apply to be pediatric ready or pediatric advanced. 2 Indiana hospitals have been recognized. 1 more needs a site review, and we are working through the logistics of that with the current COVID-19 pandemic. And then 17 other Indiana hospital emergency departments have requested applications. 3 hospitals in Indiana are recognized by Illinois' EMSC program and will be grandfathered in at a later time. Why are we doing another assessment here in 2021? 8 years post the initial assessment, we are doing another one. The portal opened May 1st. It closes July 31st, but we're asking for hospital emergency departments to complete as soon as possible. And the reason that we need this data is to determine progress in pediatric readiness. So how far have we came from 2013, identify ongoing and new gaps in pediatric readiness, promote quality improvement efforts in EDs across the country, develop national collaboratives to address common and critical gaps, and identify best practices. The assessment tool, there are 189 items on the assessment, so it is fairly large. 82 items are scored for pediatric readiness with a perfect score of 100. The NPRP assessment asks questions about hospitals and emergency departments from categories like infrastructure, resources, personnel, the administration and coordination of care for children, policies, equipment, and more. The history from the 2013 assessment, it was coordinated through all EMSC programs. It's a comprehensive web-based assessment found at pedsready.org. It's in compliance with the 2009 guidelines of care of children in the emergency department. In 2013, 5,107 hospitals, an 83% response rate, and Indiana exceeded the national response rate at 87.6, and it's on that weighted scale of 0 to 100. So how did we do here in Indiana? 106 of the 121 emergency departments completed the assessment for that response rate of 87.6. And the state median was 67, and that was just below the national average of 69. So 69 out of 100. The NPRP assessment from 2013 identified gaps. 67.7% of responding emergency departments reported weighing children in kilograms. The importance of this is weighing children in kilograms is the first step in the prevention of medication dosing errors. And it was 67.7%. So weighing children in kilograms and recording, not relying on like your medical record to do that for you to alleviate any errors that may occur. 70.1% of responding EDs reported having a written procedure in place to notify physicians when abnormal vital signs are found in children. So you can develop a notification process for abnormal vital signs for the physician. Vital signs assessment provides an early warning of changes in the patient condition and can assist in preventing deterioration of a pediatric patient. Another gap that was identified, 70.6% of responding emergency departments reported having a written transfer guideline in place. Ensuring that there are interfacility transfer guidelines that are patient and family centered for that pediatric patient. Transfer guidelines maximize available resources and minimize cost and family burden associated with transition of care to another facility. And this is of utmost importance in our state when we are seeing less and less ambulances, and then the need to get that child to a children's care center. And then another gap that was identified, 46.8% of responding EDs reported having a disaster plan that addressed children. Establishing disaster plans that include children. Children represent 25% of all disaster victims and are disproportionately impacted due to their anatomy, physiology, and development. If we've seen the news today, we heard about a condo collapse in Florida. And so how many of those kiddos are pediatrics? And so when you look at your community, you could have a school, a daycare center, an event where there are children, and a disaster could occur, either man-made or natural. And so are you prepared for the volume that may come in via EMS, or not EMS at all, may come in from a parent? How does my emergency department participate? Since the launch May 1st, ED nurse managers have received a letter and postcard via US postal mail and several email reminders. I began calling hospitals yesterday, and I've had some more challenges because some of the phone systems, I can't speak to a live person, and so some of the voicemails aren't set up. So I'm really hoping that my messages are getting across that this assessment is available right now, and that it's a self-assessment for each emergency department to take. Since only one NPRP assessment can be completed per emergency department, we are encouraging ED nurse managers to collaborate with ED leadership to participate. Once the ED nurse manager completes the NPRP assessment, they will immediately receive a pediatric readiness score from 0 to 100. The average pediatric readiness scores of emergency departments of similar pediatric volume. The average pediatric readiness score of all participating EDs to use as a benchmark, and an ED gap report to target efforts for improvement in pediatric readiness. A 2019 study found that hospitals with high ED readiness scores demonstrates a 4-fold lower rate of mortality for children with critical illnesses than those with lower readiness scores. Thus, improving pediatric readiness improves outcomes for children and their families. Why is it important to participate? The NPRP assessment helps emergency department personnel to be better prepared to provide quality care for all patients of all ages by evaluating the QI process of EDs over time. Hospital leadership, healthcare administrators, and ED personnel can demonstrate commitment to their communities by improving pediatric readiness. Where are we at as of this morning? I pulled this data at 10 a.m. Indiana's response rate is 46.2. So 61 of the 132 emergency departments have completed the assessment. We are exceeding the national response rate at this time. 1,938 emergency departments have completed it thus far across the nation and US territories. This is the current response rate by county. The white counties, for example, Fountain, Park, Carroll, Benton, Newton, Union, Franklin, Brown, Martin, and some of they're down in District 10, do not have a hospital. The lightest blue counties mean no response. The medium blue represents hospitals that have completed the assessment, and the darkest blue represents 100% response rate. Pulaski Memorial was the very first hospital to complete the assessment and is located in District 2. I know it's, if you don't know the health preparedness districts, this is kind of a hard map to look at, but when you look at the top of the map, it's not as dark blue. And so those are the counties and the hospitals that we need to reach out to and make sure that they're aware of the assessment currently underway. In District 10 and District 8, which is the lower part of the state, the left-hand side around Evansville area, there are only 2 hospitals that remain in that area, as an 8 is on the bottom right-hand side. 3 remain in District 9. Please work with emergency department leadership and ask to complete this month. This is the national map of all states and US territories that have taken the assessment. If you look at Indiana, we finally turned that first shade of light blue this week. But when you compare us to Illinois and Michigan, who have about the same amount of hospitals or just a little bit more, because you're going to want to look in the Midwest at their numbers, we need to be making sure that hospital emergency departments are aware and can respond, because this hasn't occurred since 2013, and this is what helps us address critical gaps in pediatric readiness so that we can offer collaboratives at no cost to our hospitals. The assessment can be found at pedsready.org. You'll click on the Let's Get Started tab, go to your state, your county, and you'll find your hospital. This is another way to see if your hospital has completed it. There's also some more information. You can print a copy of the assessment, so you can fill out a paper copy prior to inputting all your data on pedsready.org. It takes about 20 to 30 minutes on average to complete via the website. You can also see the national and state response rates. And then if you have questions about the assessment, those are there as well as a video. I also want to take a moment to share with you the PECC Workforce Development Collaborative, which is this is the Pediatric Emergency Care Coordinator Workforce Development. This is there's 4 customized tracks. This is for EMS practitioners or hospital-based physicians and advanced practice providers or hospital-based nurses and healthcare professionals, and as well as EMSC state partnership program managers. Registration is now available until August 1st. The mission of this national collaborative, led by the Emergency Medical Services for Children Innovation and Improvement Center, is to support healthcare professionals working in pre-hospital and emergency department systems to become effective pediatric champions, also known as PECCs. The program will run from September of this year through June of 2020. The time commitment will be approximately 2 hours each month. This collaborative will occur in 2 parts. In the first part, participants will receive monthly education, including customized guides highlighting crucial resources and best practices, strategies to help identify gaps and opportunities, and access to experts in pediatric emergency care. The second half, participants will work with peers and expert coaches to develop an improvement plan targeting one of 4 major areas. 1, enhancing the role of the PECC. Another, ensuring availability of pediatric equipment, supplies, and medications. Another, implementing a program to help maintain pediatric competencies among staff. Or another is developing a local policy, pathway, or clinical decision support tool. You can scan the barcode there or go to EMSC improvement.center. If anybody has any questions, my email address is margo.knefelkamp@indianapolis.ems.org. And again, the assessment can be found at pedsready.org. This is a very crucial time, and it's a self-assessment. All of the data goes right back to the one who completed it, so you can recognize your gaps, and then tools and resources are provided to you as well so that you can address those critical gaps in your emergency department. Thank you.
So we'll go ahead and open the lineup for anyone that has questions. We didn't have any questions come in during your presentation, Margo, but if anyone would like to ask a question now, please use the chat or Q&A function. Or if you would prefer to ask verbally, you can raise your hand and we'll be happy to unmute your line. So we'll go ahead and give it a few minutes for people to submit any questions they might have. But really informative, Margo. I think you made a great case for why people need to prioritize filling these out, especially when they get their own data back so quickly, to self-identify, not to have to wait on a report that comes out and says, here's where you need to look. You're able to see immediately some of the areas you might be able to improve your facility.
Thanks, Allie. I know we've talked about Indiana having a huge challenge with child abuse and neglect. And so at any point, one of these patients can come into your facility. And so making sure that you have that in place for not only the patient, but as well as your staff that has to work with the patient, treat the patient, and making sure that we can make sure that that child has the best outcome as possible.
Definitely. Well, I'm still not seeing any questions come in, so I'll just go ahead and thank you for your time. As I said, today's session has been recorded and will be available by the end of the week on our YouTube channel. So thank you very much, Margo.
Thank you, Allie. Bye-bye.